I'm Dr. Alfred Bove. I'm the president of the American College of Cardiology, and we wanted to discuss with you today some of the information about our patient-centered efforts at our national meeting in Atlanta, ACC.10. With me is Dr. Paul Douglas, who's the chief of cardiology at the Atlanta Medical Center, a cardiologist practicing in Atlanta, and who is one of the members of the team working on developing what we call CardioSmart Atlanta, which will be the program for patients at our national meeting. Paul, let me ask you a couple of questions about the planning. This is a patient event, and what are some of the features of the program that you're putting in place?
Well, thanks, Fred, for having me here today. And it's certainly a pleasure for me to talk about CardioSmart Atlanta. We are excited about hosting this event. This will be a community-wide event. We're inviting patients from all over Georgia to join their cardiologists at our national meeting in March. This will be an effort to empower our patients, to teach them about healthy lifestyles, how they can prevent developing heart disease. We will have health screenings. We will have discussions, one-on-one talks, both for adult patients as well as children.
Thank you. And I guess one of the things I've been really impressed with watching your group putting this together is the ability for your outreach to the local Atlanta community. I mean, clearly this is going to be for residents of the Atlanta and Atlanta area. But tell us a little bit about your contacts with some of the other organizations around the area that you've been working with to put this event on.
Yes, we have been in touch with various aspects of the Atlanta community. Not only do we want to talk to our medical societies in the Atlanta area and in Georgia, but we also have talked to social organizations. The ministry, the ministry, I think, will play an important role in terms of outreach and getting the word out so that we'll have good participation from a broad spectrum of the Atlanta community.
Thanks. So if a patient in Atlanta comes to CardioSmart Atlanta, what would they see? What would the process be as they walk in the door to the program?
Well, we are planning to have almost a carnival atmosphere. We will have health screens going on for both blood pressure, diabetic screens, teaching people about how to manage their blood pressure, how to manage their diabetes, how to manage other cardiovascular risk factors. There will be lectures that will be ongoing, again, in an attempt to empower the community. And we're going to have world-class cardiologists who will be there, who will be willing and able to counsel patients about how they can take care of themselves.
Paul, I want to thank you very much for the work you're doing on this project. I think it speaks to the efforts of the American College of Cardiology to move into patient empowerment and get more engaged with providing tools and recognition of the needs of the patients that we take care of. I mean, clearly we're a professional organization. We've spent a lot of time educating physicians, and this is one of our first endeavors to move toward providing good patient education. And I think in the future of cardiology, empowerment, that is patients participating in their care, is going to be a key part of what we do in the future. So this endeavor that you folks are putting on as part of ACC10, I think, is a tremendous step forward, the beginning of a tradition, and I think we'll have a great opportunity to bring the people of Atlanta into the world of cardiology and into better cardiovascular health. So I want to thank you for the work you're doing. Thank you for being here for the interview today. Thanks very much.
Thank you, Fred.